video, we will jump into chapter 8, where we will talk about clinical interviewing skills. And I want to note before we begin that a lot of this chapter will be kind of focused more on assessment, but it is discussing skills that are important for any work with a client. So even if you're planning on just going into psychotherapy, first of all, there will always be some sort of assessment component when you first meet a client and you're getting to know them. And second of all, a lot of these skills will translate easily to being a psychotherapist. So just to start with some pragmatics of interviewing clients, there's just some things to keep in mind. Note-taking is something that is up to the clinician's discretion. Some people like to take a lot of notes. Other people prefer to really be in the moment with the client and take notes immediately after the session. And there's kind of some pros and cons. So note-taking is a more reliable way to get details, more reliable than your memory, but it could be a distraction to the client. And it can distract from noticing important client behaviors and really just distract with kind of being in the moment with the client. So I think it's best to, practice and see kind of which details are important to note down while trying to be as present with the client as you can. Another consideration and kind of an alternative to note-taking is using audio and video recordings. So this would, of course, require the client's written permission to be recorded. And it may hinder openness and willingness to disclose information. So even if the client consents to it, it may still kind of limit their openness. And I think there needs to be a good rationale for recording. So do you have an important reason to be recording? Or is it just to kind of make your note-taking easier? The next area is confidentiality, which we've discussed a lot this last week in terms of ethics. A lot of times clients assume confidentiality when they're meeting with a therapist or an assessor. And it's really important to be very specific with your client about situations in which confidentiality will be broken, and to really explain the policies regarding confidentiality, not just when you first meet with the client, but on an ongoing basis. Lastly, we have considerations related to the interview room. So nowadays, a lot of times people are meeting with clients on the computer, but whether it's virtual or in a physical room, it's important to think about the space. It really should just facilitate the goals of the interview, minimizing distractions and personal items. When we think about clinical interviewing, we can think about kind of two broad main approaches. So we have directive interviews and non-directive. In a directive interview style, this is going to be a lot more targeted towards getting specific pieces of information. The client responses are going to be brief. You're going to be asking a lot more kind of close-ended questions. And so you're going to be able to getting data that the clients might not otherwise bring up because you're asking very pointed questions. However, this can sacrifice rapport in favor of information. On the other hand, we have non-directive interview styles. This is kind of letting the client talk about what they want to talk about. They might choose to spend more time on certain topics. And this can provide you information that you might not have known to ask about. So it can be really useful in that way. However, it can fall short in terms of gathering specific information. So finding the balance of directive and non-directive styles within an interview with a client is really helpful for boosting both data collection and rapport building. So now I'll talk about some specific interviewing techniques. These are things that you can even practice, talk with a friend and just kind of think about these ways of talking to people. It's not necessarily the same way we just naturally talk to people. It involves a lot of kind of self-monitoring and kind of being careful about what you're saying so that you're gathering good information and also showing the client that you're listening. So first we have open-ended questions and close-ended questions. So open-ended questions, as you probably know, allow for individualized, spontaneous responses. The clients might give you a lot of information, but they might kind of give you irrelevant details. And this is a really key part of non-directive interviewing style. So asking open-ended questions, letting the client take it from there. Close-ended questions are going to allow for a lot less elaboration and self-expression from the client, but you're going to get quick and precise answers. So if you just need to get a lot of information, it's good to ask close-ended questions. And these are used in directive interviewing styles. The technique called clarification is used to ensure the interview is getting an accurate understanding of what the client is saying. This is really just showing the client that you get it and allowing you to confirm the details that you received from the client. It also communicates that you're actively listening. So it's helpful not just in clarifying details, but in communicating active listening to the client. And it's good to kind of wait, not necessarily always demand clarification right away, but to kind of weave these in through your larger conversation. So just as an example, maybe a client has been talking to you for a while. You might say something like, I just want to make sure I have this right. You started feeling depressed after you moved to Honolulu. So in that statement, you're kind of confirming details and showing them that you're listening. In the technique that we're calling confrontation, it's pretty similar to clarification, but this is focusing on clarifying contradictory information. So this is really helpful when the client is maybe telling a long story and there's inconsistencies or discrepancies in the information they gave you. So just as an example, you might say to a client, earlier you said that you started feeling depressed when you moved here, but you also just noted some feelings of depression when you were in high school. Can you help me understand when this first started for you? In the technique of paraphrasing, this is used to assure clients that they're being accurately heard. So this is kind of restating the content of their comments using similar language. And you're really just maintaining the conversation. You're not like shifting to a different direction. You're just paraphrasing what they've already told you. So if the client says something like, I feel terrible about myself when I'm depressed, it's hard to find anything positive to say, the therapist might say, your feelings of depression are really affecting your self-confidence. So in a way, it's different words, but it's really just reflecting what the client is already saying. We also can do reflection of feeling. And this is a really useful tool in echoing the client's emotions and really helping them feel that their emotions are recognized. And it also can help clients who maybe have a hard time talking about their emotions. It's helping provide them words that match their experience. So this is including having the interview kind of make an inference about the emotions that the client is experiencing, which can take some practice to do. So let's say you have a client in session and you notice that they're tearing up while they say, it's hard to talk about my depression with my friends. The therapist might say, you feel alone in managing these difficulties. So the therapist is providing words about loneliness to the client. So the next technique we have is summarizing. And this helps tie together various topics of discussion, statements that might have been made at different points throughout the interview. These might be themes that have kind of recurred during the interview or things that the client has brought up. And this really helps the client know that they have been understood in a comprehensive, integrative way. So something you might say is, it seems like since you moved to Honolulu, you've been struggling with these really low moods, which have gotten worse since you've switched jobs and developed some sleep difficulties. You've been trying to manage it all on your own, but you're willing to discuss them here with me today, and you are motivated to work towards improving things. So this is a statement that's kind of full of information that probably took like a long time to gather that information, and this is really just summarizing it nicely. Next, we have conclusions. And this really depends on the interview type, the setting, the client's problem. And by that, what I mean is, if this is a one-time assessment, the conclusions are going to look a lot differently than if this is a client that you're going to be working with on an ongoing basis. But the goal of providing a conclusion is to provide an initial conceptualization of the client's problem. This might include specific diagnosis or treatment recommendations, or just kind of an overall concluding statement of what you discussed. So as an example, you might say something like, based on what we've discussed today, it appears that you likely meet criteria for a diagnosis of persistent depressive disorder, which is how we describe this kind of long-standing low mood you've been experiencing. There are a number of different strategies we can discuss that have helped many people get unstuck that we can explore together. In terms of general skills, it's good to think about how you are presenting yourself when you're working with clients. And these take practice, and they're things that you can practice starting now, just how you kind of comport yourself with other people. So quieting yourself. And what this means is allowing the other person to talk, but also quieting your mind and really being there and taking in what the client is saying. And this can take practice because especially when you're first starting out, you're going to be feeling anxious about meeting with a client. You're going to have a lot of thoughts running through your mind. And it's really important to kind of practice emptying those thoughts and really being there with the client. It's also important to learn how to become self-aware. The clients will look to you for guidance and support, and seeing how you're comporting yourself is really important part of working in the mental health profession. And just working on developing positive working relationships with clients. So, learning the skills to do good assessment and therapy, but also being welcoming when they first arrive, having smooth transitions, just having these kind of general social skills to have positive relationships. In terms of specific behaviors, we can discuss eye contact. So as you probably know from personal experience, this really helps communicate that someone is listening. When you're looking at them and really nodding along and making the client feel heard. But this does require some cultural knowledge and sensitivity because eye contact does vary by culture and subculture. And it's important to be mindful of this when you're meeting with a client and really try to show them that you're actively listening in a culturally appropriate way. Similarly, we have body language. And culture also shapes the connotations of body language. So really being mindful of how you're presenting yourself. There's some good general rules, such as facing the client, appearing attentive, minimizing restlessness, and displaying appropriate facial expressions. It's also good to be mindful of your voice. So noting your pitch, tone, volume, and fluctuation. As well as being able to attend closely to the vocal qualities of clients, because that can be really useful information to understand how their mood is, how their general mental state is, how they're doing on a particular day, that sort of thing. Another specific skill that's useful to develop is what we call verbal tracking. And this is essentially when the interviewer is monitoring the client's train of thought by repeating key words and phrases that the client has used. And this includes weaving the client's own language into your words. So if the client is using a particular phrase, even if it doesn't match up with how you've learned about what they're talking about, it's really good to be on the same page as the client and use their language. This also shows that you've been following along to their train of thought by repeating the things that they've been saying. And it's also a useful skill to be able to use verbal tracking to shift the conversation. So by grabbing onto something that the client said, shifting it into a direction by repeating what they've said and then kind of taking your own spin on it. It's also important to refer to the client by their proper name. This might sound obvious, but it can be a little tricky. People from different cultures use different names. So, some people prefer to be addressed as by their last name versus first name. You might use the wrong nickname. So really just asking the client how they prefer to be addressed and being consistent with that is important. And lastly, it's really important to observe the client's behaviors. So not just paying attention to what they're telling you, but also watching them. As you can imagine, a lot of important decisions can be informed by behavioral observations. You can tell if a client is maybe thinking one thing and saying another, or experiencing a strong emotional response or a lack of an emotional response. This is all very helpful nonverbal information to pay attention to.